Well, thank you for that introduction. And I firstly want to thank everybody for joining. I appreciate everyone taking out the time this evening to listen into my presentation. So the presentation this evening, we're going to be talking about benign prostatic hyperplasia. Now, this is just some things. I guess you've already got my introduction, not to waste time, and just some of the different types of procedures that I do, which it does include benign prostatic hyperplasia. So what we're going to cover in this discussion is we're going to talk a little bit about the prostate itself, so we kind of understand the anatomy, and we're talking about benign prostatic hyperplasia. And then we're going to go on to talk about some of the overview of what are the symptoms and how it's actually diagnosed. And then we'll kind of conclude with a little bit about the treatment options. So a little bit of overview of the prostate, just a little bit of anatomy here, not to bore everybody, but again, just so we kind of understand, the prostate is kind of like a walnut-shaped structure that's unique to males, not found in females. It sits just below the bladder. And I always tell people the best way to think about the prostate is if you think about a donut, and in the center of the donut, that's where the urethra, that's the tube that carries the urine, that's where that flows. So that would really give you an idea of if you think of the urethra as a tube and the donut around it is the prostate. People always ask me, hey, so why don't we just get rid of our prostate when we're young? Well, the prostate actually produces fluids that are very important for fertility. So if you don't have a prostate, you really wouldn't be able to have a child. Normally, a prostate will grow from early childhood to about the age of 20. And then again, we start seeing the hyperplasia that usually starts in men around the age of 40. So just to kind of clarify, because there's a lot of, in terms of people understanding what are the differences. So there's three different entities. One is enlarged prostate, which is what we call benign. And benign by nature means it's not related to any cancerous, it's not a malignancy, it's not an infectious process. This is just something that happens in all males after the age of 40, to some males more, to some males less. And then we have the prostatitis, and the third thing being the prostate cancer. A little overview about BPH. Basically, again, you have the benign, benign is where the B comes in. P means prostatic, and H means enlargement, meaning the hyperplasia. Again, this just to reiterate so everybody's clear again. BPH is not prostate cancer. It does not cause prostate cancer, and there's no correlation with enlargement of the prostates being related to prostate cancer. The only one thing to note is people that do have prostate cancer can have symptoms of enlargement, so it can coexist in patients with prostate cancer. We do a screening test for prostate cancer. It's called the PSA, and it's important to note that the PSA can go up in both prostate cancer and in BPH, so it's important to try and differentiate what is causing the rise of the PSA. So here, this just depicts what I kind of told you. Again, going back to that image that you all should have in your head by now, the donut around the tube. You see how the tube is nice and open here. As our donut gets bigger, it squeezes off the tube, and you can understand how it would make it harder for somebody to urinate and having more difficulty with the urination. So what are the symptoms that we typically see with somebody who has enlargement of the prostate? Well, typically you'll start seeing frequent urination, meaning that you're going more often than you were earlier. Sudden urge to urinate, and that's more a function, if you think of the pump behind the bladder, it's having to work harder to overcome this blockage that's now been created by the enlarged prostate. Occasionally you can have some painful urination. The big sign we see a lot of is a weak stream, meaning that you just feel like you're going, but it's not complete, and the flow is very, very weak. Typically you can spot these guys if you go to a sports game and the guy who's standing at the stall for a long time, he usually got BPH because it takes much longer than the average guy to empty his bladder. The other thing is a sensation that you're not empty. You go and you feel like you have to go again, starting and stopping. And worst of all, when it really gets bad is you just can't urinate. And at that point, you need some sort of intervention. So I think that if we look at BPH, it will affect many men. Up to 95% of men are unhappy with the symptoms and want to have something done about it. The biggest issues being the slow stream and having to get up frequently at night. And so that's where the 51% comes in. It interferes with men's life in terms of constantly getting up 2-3 times a night. disturbed sleep patterns and other issues. Some men also complain of having sexual problems, and this also can be related in terms of the enlarged prostate causing difficulty with ejaculation, discomfort, and the volume of ejaculation. So BPH is the most common prostate problem for men over the age of 50. It affects 50% of men by the age of 60 and 90% of men by the age of 85. So you can see this is a very common problem. It's going to hit everybody. If you get it, you're not alone. It's very common. They estimate in 2010 as many as 14 million men in the United States had symptoms of BPH. People that are overweight do have a slightly increased chance of having symptoms and of having more problems with BPH. So when you see your physician or your urologist, usually what will happen first is they'll examine you. It starts by a digital rectal examination. For those of you who don't understand this, this basically involves placing a finger into the rectum, and through the wall of the rectum, we're able to palpate the prostate, and that gives us a size of how big the prostate is. Also, that helps us to make sure there's no nodules or anything suspicious for prostate cancer. We can also have the patient urinate into machines that tell us how strong the flow is, and do little bladder scans to see if the patient is emptying. Occasionally, there also are tests that we do. We have written, there's an international prostate symptom score, and this is just a way of the patient telling us how much they're actually bothered by the symptoms, and each getting up at night, frequency, urgency is given a number, and we add those numbers up, and we're able to evaluate how severe the symptoms are. And also, once we start the treatments, we can do these tests again and see if the symptoms are improving. So let's talk a little bit now about some of the treatment options. The first thing, and actually is like everybody likes, the simple behavioral modification, meaning that you drink less water, you'll go less often. You try and retrain your bladder, do something called Kegel exercises, as well as something which I call time voiding, trying to go regularly to the bathroom. These can be helpful early on, but usually over time, as the prostate enlarges, they become more issues. We have what we call the first line treatments, meaning either drugs or minimally invasive treatments, and those include the BPH medications, examples being the Flomax, tamsulosin, Rapaflo. In that, I would include the Rezūm Water Vapor Therapy treatment, and then there are the implants, which actually just separate the prostate tissue apart. Once we've kind of exhausted the first line treatments, we go on to surgical procedures. Among these are the GreenLight laser treatment, the TURE, which is a transurethral resection of the prostate, or previously some people may have heard as a Roto-Rooter job, where we go and actually scrape out the tissue. And then there is an open procedure, which we do less and less of when the prostate is really enlarged. So I think the first thing to realize that, and I think a lot of people get fooled, people especially watch late night television, you see all these dietary supplements that are being sold on late night television for your enlarged prostate. And to date, there has been no study that's shown any of these agents, including salt palmetto, really have any long-term effect on BPH. So I think it's important, before people start wasting their money and energy on these so-called miracle prostate formulas, prostate drugs, they should be aware that they really, for the most part, most of them are not effective and will not produce long-term lasting results. So when we talk about watchful waiting, meaning the simple thing, try and modify how much you're drinking, see if you can try and use Kegel exercises. For the most part, these work for a limited time, but as the prostate starts to grow, they become less and less effective. And the problem is symptoms may get worse, and eventually you may run into more trouble in terms of having more urgency frequency, as the bladder will suffer with the increased blockage of the prostate. Alpha blockers. Now, many of you may have heard of these different drugs. There's by name brands. They go by drugs such as Flomax or tamsulosin. There's Rapaflo, doxazosin. There's a whole array of drugs that are out there. And basically how these drugs work is they relax the prostate, making it easier for the patient to empty the bladder. But the thing to realize here, we are not, by taking the medication, you are not treating the blockage. All you're doing is you're relaxing the blockage. And the moment you stop the drug, you'll go back to the way you were. So basically, I look at drugs as a Band-Aid that just kind of take care of the symptoms as long as you're taking them. Side effects of these drugs: drop in blood pressure, dizziness, fainting, fatigue, and interaction with other drugs. And remember, if you want to stay on the drug, that's fine, but you're committed to drugs for the rest of your life. So that's something to bear in mind. There's also what we call the finasteride, or the 5-alpha reductase. This is another drug that we've used in the past to shrink the prostate. It can work in certain patients, but takes up to 18 months in most patients to shrink the prostate. And the problem being, patients just don't want to stay on something that long. And the finasteride per se will decrease the volume of ejaculation, and has also been shown to cause some problems with erectile dysfunction. Let's talk a little bit about the Rezūm Water Therapy. Now, what is the Rezūm Water Therapy? Well, basically what that is this is an outpatient therapy that we use, and what it does is it uses natural energy stored in the water vapor to kind of shrink the prostate tissue, thereby opening up a passage. Usually it's done without general anesthesia, and we can talk a little bit about that. In our setting, we do use a little bit of sedation. It works quite well. I think the number you want to really look at here, which is, and I think people need to be very careful when you decide treatments, there's only a 4% risk of retreatment within 5 years. So if you've decided now to do something for your enlarged prostate, you want to be sure that it's sustainable. I think the nice thing about the Rezūm Water Vapor Therapy is that even after 5 years, only 4% of patients actually needed to have treatment again. What are the side effects? Well, I always warn patients, naturally you are destroying some tissue, so there'll be a little bit of pain and some frequent urination. You might have a little burning discomfort, urge to urinate, but usually most of these symptoms, I would say, within the first 3 to 4 weeks disappear, and thereafter the tissue has kind of sloughed off and the urination improves markedly. So just to give you an idea of how the Rezūm therapy works, this basically shows us before. You see you have the bladder over here, and again, the donut with the urethra in the center. You see how it's kind of squeezing up against the tube and making it harder for you to urinate. Once you do the Rezūm, basically the tissue that was kind of squeezing is kind of, with the water vapor, has been destroyed, and this opens up the passage wide open and kind of makes it much easier to avoid. I'm going to now show you just a little video on the treatment itself to give you a better idea of how it actually works.
Rezūm Water Vapor Therapy is a non-surgical treatment for BPH. Rezūm uses the natural energy found in steam to shrink the prostate. In just seconds, this precise technology destroys enlarged prostate tissue while minimizing any effect on surrounding tissue. Rezūm is a potential alternative to drug therapy, permanent implants, and surgery. It preserves sexual and urinary functions, and it's clinically proven to safely and effectively reduce BPH symptoms. Potential side effects include painful urination, blood in the urine or semen, pelvic pain, and urinary frequency, retention, or urgency. The procedure is performed right in your doctor's office or outpatient center. You do not need general anesthesia for the procedure, and Rezūm therapy lets you quickly return to normal activities. Talk to your doctor about Rezūm if you're no longer comfortable with your BPH symptoms. Drug therapy isn't working for you. The side effects from drugs are impacting your quality of life, or you don't want to have surgery or get an implant.
So that's just a little overview of the Rezūm therapy. So I just want to give you the next thing would be a little testimonial from a patient who actually underwent the Rezūm therapy. And I think the thing to note here is 97% of patients who actually have had the procedure would recommend it to their friends.
I found out that I had BPH. My symptoms were a slow stream, and I would wake up frequently in the middle of the night. I first heard of Rezūm when I was researching enlarged prostate and the procedures to repair it, to fix it. And Rezūm was one of them. The more I researched Rezūm, it was the latest and greatest technology, and I want to be part of new technology. I think technology is good. My experience with the Rezūm procedure was very good. After the procedure, I was a little worn, a little tired, and the next day I felt fairly good and was able to get up and get around.
Since Joe's Rezūm procedure, we're able to spend much more quality time together, fewer interruptions, and we're just happier as a couple. The Rezūm treatment has made a very big difference in our life.
The other treatment I want to mention here is the prostatic urethral lift, or the procedure that actually basically uses permanent implants to lift and hold enlarged tissue. It does work well also with no anesthesia. The concern naturally are there is a higher risk of retreatment, and I guess the one thing we want to bear in mind, it does involve placing permanent implants, which are little titanium implants that stay there. I think the side effects are pretty much the same afterwards. You have some painful urination, blood in the urine, excuse me. But the big concern would be over the long term, you have a permanent implant and you can develop these stones, so you have to be a little bit concerned about that. The GreenLight laser therapy, that's a little bit more involved treatment. That basically would take place of the old, what I call the TURE. It's done with an anesthetic. The results are very, very good. We actually do it in our office here under a mild anesthetic, works very well. It's more involved than the Rezūm procedure. You're looking at a little longer recovery. But the one thing to bear in mind is that you will have the similar painful urination, but once you do the GreenLight, as opposed to the Rezūm, you are opening up the prostate for a wider path, so you will end up with almost no ejaculation. So if that's a concern, erectile function and having a proper orgasm, I think the Rezūm would be a better procedure of choice in that situation. So just again, to kind of reiterate, how does the GreenLight work? Same idea. You have, again, our bladder here, the prostate, the donut, like I mentioned, around the urethra. It's kind of squeezing it off. We basically use the laser energy to kind of destroy all this tissue, and kind of does the same idea. I'll just give you a quick overview, just to give an idea of how it works, just demonstrate that. So you get an idea of the same idea. Basically, you're using the laser to destroy all this tissue. But like I said, with the GreenLight, you tend to open up much wider. And so then what happens is you will have a dry orgasm, meaning that you'll have retrograde ejaculation. You won't see ejaculation when you're sexually active. So moving along here, the TURE, I guess that's an older procedure, transurethral resection of the prostate, or what was previously known as a roto-rooter. Usually done in the hospital, never done in the office setting. I think it's become a more procedure of the past. The problem with it is usually you're looking at overnight stay in the hospital, increased risk of bleeding. It works well, but again, you have erectile issues with it. So it's not a procedure we're doing as much now as we were back, let's say 20 years ago. I think the GreenLight's taken place at that. Prostatectomy, again, I'll just kind of mention it quickly, almost rarely done, only in the setting of where you have a really large prostate, you don't think it's amenable to any minimally invasive procedure, then you would consider that. But again, very, very rarely done. Insurance coverage, I would say for the most part, this slide here mentions the responsibility of the patient to contact their insurance in our office setting. Most of these procedures are covered by all the insurances. Really, we've had no issue with the Rezūm as well as GreenLight getting coverage, but we work along with our patients to make sure they're totally covered by the insurance. So, in summary, what is a prostate? We basically understand it's a walnut-shaped gland that sits underneath the bladder, and basically its function is infertility. As a man gets older, we get something called BPH, benign prostatic hyperplasia. Your treatment options are watchful waiting, which again works for a limited time. Eventually, symptoms will get worse. Medical treatment, which I went over, the drugs, they work well, but as long as you take them and you're committed to a pill for the rest of your life. So I look at the medical treatment kind of like a Band-Aid on this problem. You're not treating the issue, you're just kind of putting a Band-Aid on it. The Rezūm Water Vapor Therapy, minimally invasive, done in the office, very good results, minimal side effects, good results. The implants also works quite well, also can be done in the office, but again, you are left with an implant. And then the more involved procedures are the GreenLight laser, the TURE, and the prostatectomy. So if you are suffering from symptoms of BPH, I would highly encourage you, first of all, to stop all supplements that you might be getting from your late night television. Look into consulting with your urologist to look at treatment options, because there are so many options available. It affects your sleep pattern, affects your lifestyle, affects your state of well-being. I think there's easy ways to fix it. And I think the big thing to realize, it doesn't get better with time, it only progresses. So I think if there's a theme here tonight, it's if you are suffering, seek out consultation, see your urologist, see a specialist who can help you, and look at all the different options and understand the options that are available.